All right, folks, new year, and it's time for some pre-cals. Robert, what's going on today?
Hey, by the way, just a disclaimer: if you're on the YouTube channel and you see Emerson and he's sort of in this direction and blurry, it's just a technical difficulty. There he goes. Now we've got him.
Oh, I didn't know I was sideways, so there we go.
Hey, I tried to let you know, but
Yeah, sorry, I can't get text on here at the moment.
That's all right.
it's
So
all good.
we have with us today Dr. Stephen Park. He is another sleep celebrity. Is joining us. This is someone who has 53,000 YouTube subscribers. He's had a #1 bestseller on the Amazon list with a book that's called Sleep Interrupted. A physician reveals the #1 reason why so many of us are sick and tired. He's previously a surgeon, but he actually left practice in 2021 so he could focus on this sort of sleep health and general public awareness campaign and crusade, really. So we're excited to have Dr. Stephen Park with us.
Excellent. All right, you guys ready?
Yeah, let's do
Do
it.
it.
Let's do it. All right, then. On to the show. Now, a word from our sponsor, MedBridge Healthcare. MedBridge Healthcare is a leading provider of sleep lab management services and home sleep apnea testing. MedBridge partners with hospitals, healthcare systems, and medical academic institutions to offer comprehensive, fully integrated services for sleep disorders.
Lights out.
Welcome, everyone, once again to another episode of SleepTech Talk, the sleep podcast with your hosts and friends, Emerson Kerr, Robert Miller, and me, Dr. Gerald George Mannikarote. Everyone, it's a new year, new day, new week. Everything is new, and we're really excited to bring you another fantastic guest and a very interesting guest on SleepTech Talk. He has his own show, but to tell us a little bit more about this, let me toss it over to Robert. Robert, go ahead, please.
Hey, thank you, Jerry. So we have with us today Dr. Stephen Park. He left the field of medicine in 2021 to focus his energy on educating the general public. Through his mission, he's got a website, drstephenpark.com, and he also has Healthwise Media, LLC. He has 53,000 YouTube subscribers. Maybe the number's even higher since I wrote this note, but his podcast, Breathe Better, Sleep Better, Live Better, is certainly successful. He's also a published author. He has an Amazon best-selling book. It's called Sleep Interrupted. A physician reveals the #1 reason why so many of us are sick and tired. He's a fellow of the American Academy of Otolaryngology, Head and Neck Surgery, a member of the American Academy of Sleep Medicine, board certified in otolaryngology, head and neck surgery. He is a former assistant professor of otolaryngology at Albert Einstein College of Medicine in the Bronx, New York, and was actively involved in teaching residents and other surgeons cutting-edge surgical techniques. So, Dr. Park, we're so happy to have you today, and we appreciate you joining us on the podcast.
Thanks for inviting me. Really excited to be here.
Absolutely. Well, tell us a little bit. We typically sort of jump in, right out of the gate and have you talk a little bit about your journey into sleep medicine. So maybe we could start with that, and then I know there's some interesting topics that we talked about that we want to cover in this episode of the show.
Sure. Well, I was trained as a surgeon. That's what I did for the first 13 years in private practice in Manhattan. And then during my time as a general ENT surgeon, I discovered that a lot of my sinus surgery patients snored. And when I started to get sleep studies, almost everyone had sleep apnea. And then so I started treating the sleep apnea before offering surgery. And just surprisingly, more than half the people didn't need surgery anymore. So then that led me into this rabbit hole of studies and connections between sleep apnea and acid reflux, chronic sinusitis, and everything goes back and forth. And then that kind of opened my eyes as to how to look at health and wellness, not just ENT problems, but wellness in general, from a totally different perspective, which is if you sleep better, everything else gets much better. But then alongside that, I started doing a lot of innovative sleep apnea surgery techniques, including the feasibility studies for the tongue nerve stimulation pacemaker option. That was like in 2010. And then I went into academic medicine to continue the research and doing further studies. But when I left medicine about 2 years ago, I decided to just take it to a different direction to incorporate other topics, other areas, more of an integrative, holistic sleep apnea surgeon. I guess that's an oxymoron, but just to address everything that's out there to improve your sleep, not just surgery, not just medicines, not just all the gadgets, devices, but everything out there. And so that's been very, very rewarding. And I mentioned in our discussion beforehand that I have what's called upper airway resistance syndrome, which is a precursor stage before sleep apnea, and my wife does too. And I talk about that in my book as well. So this is a personal issue for me, and my journey has been just amazing these past 20, 30 years I've been doing this. Every year we're getting better and better. So I feel better now than I did when I was in my 20s.
That's really interesting, Doc, and thank you so much for that. And it's interesting how you have evolved in your approach. And just before we actually started the recording, we talked about the different things that you've dabbled in. Obviously, Robert has spoken a little bit about that as well. Can you tell us a little bit about your YouTube channel, in particular, the one that got the most number of hits?
Yeah, so I started the YouTube channel maybe a couple years ago, and it was kind of floundering. I just did it as a hobby. I was trying to also improve my technique and my presentation, which I still need to work on. But I started doing a lot of sleep apnea topics because that's my area of expertise. But then I started to do more general topics like headaches, even throat pain before women's periods. That's another one that got a lot of hits. And then I did one on Nocturia, or nighttime urination, and how it relates to sleep apnea. And somehow it went viral. And next thing I know, it got over 1 million views over a 2-week period. And it's still going up. It's at 1.8 million right now. And of course, because of that, I have 3 or 4 other videos that are kind of approaching 1 million now. And so it's definitely escalating slowly. So it's surprising. So now I'm more motivated to do more videos. And obviously, the more visibility I have, the more I can help people. Because a lot of people, I get all these incredible comments saying that I tried your tip and my life has changed, or you sent me to the right doctor. So it's been very rewarding for me to be able to share this information with so many people.
No doubt. And that's so wild to hear that about the thing about people looking for answers on Nocturia. And as we talked about in clinic, you really don't hear that. That's something that you have to elicit from the patient by asking questions. I mean, all 4 of us here have been in clinic, and we've all experienced that, where you had to ask the patient, do you get up during the night? Do you get up? So could you talk a little bit more on that, please, to that particular piece?
Right. Well, when most people have symptoms of nighttime urination, they think it's either a prostate problem for men or a bladder problem for women. And especially as you get older, it's very common. And there's a long list of symptoms or conditions that can cause it. So what I did was I looked at the top 25 YouTube videos on nighttime urination, and all of these had over 1 million views. And basically about 95% of the recommendations were all the same, the top 5, 6, 7 to 8 things. But rarely did anybody mention sleep apnea. Now, long time ago, I came across a study, this was in the urology journal, showing that if you take a bunch of, let's say 100 patients with nighttime urination and put them through sleep studies, about 2/3 had significant sleep apnea. And then when you put them on CPAP, half those patients were cured instantly. That was a shocking finding for me. But when I discussed this with my urology colleagues, they kind of poo-poo it, thinking, oh, it's just a fluke. That can't happen because it's a prostate problem. So you want me to explain how that happens with sleep apnea and nighttime urination?
Yes, please. Yes,
Yeah,
please.
Absolutely.
So what happens is when you have an apnea, when you stop breathing, you take a deep breath against a closed throat. So you expand your chest cavity and you create this tremendous vacuum effect in your chest cavity, this negative pressure. And what happens is that stretches out your heart, especially your atrial chambers, like a balloon, like sucking on a balloon inside a chamber. The right atrial chamber of your heart thinks that there's too much blood coming in. So it produces a hormone called atrial natriuretic peptide that goes to your kidneys to make you pee more urine, to get rid of the fluid. And so you make a little extra urine throughout the night as you have these mild apneas. But then what happens is around 3 a.m., and this is the most common time that people wake up. And there are other names for it, like the bewitching hour, or there's lots of different non-medical terms for it too. But 3 a.m. is when you go into your first long period of REM sleep, when your muscles are most relaxed, and you've been making more urine throughout the night. And also because you're sleeping, your sleep drive goes down throughout the night as you sleep. And so all these factors kind of converge, they crisscross. And around 3 a.m., that's when you're going to have your longest apnea, the first one that's really long, and then you wake up and you think you have to go to the bathroom. But there was a study showing that in people who wake up to go to the bathroom, they actually put pressure catheters on the bladder to see are their bladders distended when they wake up, and they found that no. The reason why they woke up is because they stopped breathing and they thought they had to go to the bathroom. It's usually not too much urine.
So a question for you. I think in my mind, I'm assuming that the prevalence is higher in men than women, but is that actually the case?
I don't have the figures, but my guess is no, because especially women after menopause, that's when sleep apnea gets much worse for women. But a lot of young women with upper airway resistance syndrome also have nighttime urination too. They think they have an irritable bladder or some other condition, like drinking too much water.
So what patient populations from a screening perspective would you think sort of fit into the right category to look for specific issues related to nocturia and sleep apnea? I mean, I know that we could screen for sleep apnea, but are there other health conditions that would also sort of exacerbate and that would relate to these patients who experience nocturia?
Well, historically, I mentioned before that men with prostate problems, enlarged prostates, but they've actually shown that the size of a bladder has no relation to nighttime urination. That was surprising. But in terms of looking for symptoms, I would say every age, from a young child all the way to the senior years, because young children have bedwetting. It's the same problem. For example, young children with large tonsils, nighttime urination or bedwetting is a very common symptom of large tonsils. And then when you take out the tonsils, it gets cured.
No, I was just saying, please continue. Please continue.
This brings up a story about this. I think there was a 6-year-old or 5-year-old boy who came in with large tonsils, obviously apnea, and like kissing tonsils in the middle. And I started asking him some questions, and I asked him, because he kept waking up in the middle of the night. He wet his bed all the time. Every night for the past year, he's been wetting his bed. And they went to all the different doctors and they couldn't help him. And I asked him, do you eat late? He goes, no. Good. Well, do you have anything before you go to bed? Yeah, I have ice cream every night before I go to bed. So I told him, stop eating the ice cream. And then within 2 weeks, he was having no more nighttime urination or bedwetting. He was cured. And his tonsils shrank too. And
I'm in trouble. I love ice cream at night.
So my point is, don't eat close to bedtime, and we can talk about why a little bit later. Yeah,
that's absolutely fascinating, and I love the fact that it was not. I mean, being a surgeon, it's easy to say, okay, let's cut, right? But to be able to do something on a more holistic approach, where you're actually asking the patient and eliciting that consult, the information from the consult, that bit of data. Are you eating anything? No, I don't eat that late at night. Well, do you have anything before you go to bed? And if he gets ice cream, then you know that that triggers the tonsils. It's absolutely fascinating. But to your point about that, let's if you don't mind, let's go into that a little bit more. You said you wanted to talk about that a little bit more in detail.
Are you a sleep tech looking for new opportunities? Well, MedBridge Healthcare is one of the largest employers of sleep technologists, and they are growing. If you are a sleep technologist interested in a new position, potential paid relocation, or looking for a career advancement, consider a career with MedBridge Healthcare. Now back to the show.
So the reason why, well, let me back up a little bit. So whenever you have any general condition, whether it's ENT problems or sleep apnea or just medical problems, when you give them some kind of a conservative treatment, or even with medical treatment or surgical treatment, I have this 1/3 rule, meaning that 1/3 of patients will do really well, no matter what you do. And 1/3 will get some results or maybe some mild results, and 1/3 will get no results or worse results. So the general rule of thumb, you could say 1/3 is the placebo rule, the placebo effect, right? But regardless, everything you do has different degrees of effectiveness. So that child I mentioned, he was one of the 1/3 where it worked really well. But that doesn't work for everybody. But for a lot of people, it does work. So maybe in 2/3 of people, it works minimally or it works very well to maybe somewhat. And so that's why you have to try the conservative options first. Now, other non-surgical ways of treating that in this day and age, I would have recommended a palatal expander for children that age, and that does as good of a job as tonsillectomy to treat the sleep apnea. And when you combine the two together, you get even better results. So there are a lot of dental issues, and that's what I talk about in my book, Sleep Apnea, is that because modern humans' faces are shrinking, our teeth are getting more crowded, and our airways are getting smaller and smaller. So it predisposes you to these sleep breathing problems.
Doc, when you think about these conversations, and particularly our audience, how can they do a good job of communicating and educating the patient? Because this is a touchy topic. When we begin to talk about something like this, it's embarrassing. The patient might even want to have that kind of discussion. What are some things, in regard to this that our listeners questions they can ask to probe the patient to draw this information out of them? Because you're describing patients across the spectrum from mild, sleep apnea with like UARS to severe that have this condition. What should our listeners be thinking about as they have these conversations with their patients?
Well, obviously, you're not going to discount any other condition that they're thinking about or what their doctor was suggesting that could cause it. So I'm not discounting anything else that they're getting treated for. I'm just asking them to consider one other condition, which is sleep apnea. And so one thing that you could say when you're talking to a patient is, for example, oh, I just read about this patient that had a really bad problem going to the bathroom at night, and he also snored. And when they treated the snoring, the nighttime urination got better. So you give anecdotes or stories like that to kind of pique people's interest, kind of plant a seed. So you're not telling them that you have to go see a sleep doctor. But then when you talk about snoring and sleep problems, that'll kind of pique their interest, and they'll say, oh, I haven't been able to sleep for the past 3 years. So I think they're very gentle, careful, and thoughtful ways of bringing up this topic without forcing it on them.
But I know that you spent some time on the topic of nocturia. Have you found, and I just recently found it myself, like there's actually a very large Facebook group that covers, and it's just patient driven, where it's a support group for patients who have delayed sleep phase syndrome.
Yep.
Have you found any of those types of resources that are related to nocturia and sleep issues?
So this is maybe a long time ago. I went and participated in those kind of groups. I forget what was it, medhelp.com had many different topics, and I was a moderator. And so I did a lot of research in these topics to see from a patient's perspective what they're saying and what their concerns are. And I think the problem is that, for example, with nocturia, most patients have already convinced themselves that, for example, an older man, it's because of a large prostate. And they kind of discount other possibilities. And it's sometimes it can be really, really hard to convince them to even look at this other option. Like, for example, on my website, most of the comments are very good. But once in a while, these comments are like, well, that's ridiculous. I have a large prostate. Or I go to the bathroom because I drink water before I go to sleep. Yes, that's true.
Yeah.
So I'm just saying that look at these other options. So that's one of the things that I think has helped me educate myself beyond medical school education and residency, is listening to patients and people online. Because unfortunately, doctors have this tendency to discount what patients say that doesn't fit the picture, what the textbooks say.
So that's very interesting that you're saying that, because we've had several physicians here that have talked about this sort of thing, and they I think the big piece of this is the fact that they make it a little more, what's the word I'm looking for? Comprehensive when they're having their conversation with their patients. they ask the questions, they ask about the family and such, and it sounds like that you're doing the same thing, without beating the word holistic
Mhm.
over and over again. It definitely sounds like that. What caused you to turn from the surgery method and then start moving in this direction?
Well, I don't discount surgery. I mean, if I could, I would still do the surgery. I really love doing surgery, and when I do it, I get good results. But so even the surgery, I'm saying don't discount it, because there's certain people that they would say, I would never do surgery, no matter what. And some people need surgery because they have anatomical structural issues that will never get better with any medical treatment. And so my philosophy is to first start off conservative and then go up the ladder, the different level of aggressiveness that's appropriate. And then some people, a very small amount of people at the top, need second surgical intervention. And that's because we have these anatomic issues it's really shocking how narrow our airways are. And sometimes there are things that happen inside the throat that are completely not amenable to CPAP or dental devices. There's no way they're going to do better. For example, I'll give you a quick example, a little bit esoteric, but there's something called the epiglottis, which is this cartilage hood on top of the voice box, right behind the tongue. And so because the cartilage is very floppy, as you breathe in, it just sucks in like a suction cup. And you go, yes. And so if you're trying to use CPAP, there's no way it's going to work. But unfortunately, that the only way to treat that from what I've seen is surgery. But there's other conservative ways, like for example, you can move the jaw forward using a mouth guard. That works sometimes. And there was a case report of that being cured with tongue exercises too. So again, you try the conservative options first, and then if that doesn't work, don't rule out surgery.
That's awesome. Well, I know that you have spent a lot of time and energy and effort in developing, and I'm cutting in before Jerry cuts us off. In developing your platform, you have a voice in the sleep industry today. Now through the different channels that you've created, what's on tap for you in 2024?
Well, it may be premature to announce this, but I'm thinking about going back into clinical practice. Because there's only, well, actually, honestly, the last 2 years, it's been like a big blessing for me, because it was almost like a sabbatical. So I was away. I was away from the clinical responsibilities, and I had a chance to learn so much. And it just really solidified and coalesced to this bigger, broader view of health and wellness. So I also became a health, wellness, and sleep coach. And that also was very educational for me too, to be able to coach people, not as a medical doctor. But one of my big projects that's in the pipeline, I was writing the preface for this today, is my next book. It's like a follow-up to my first book, Sleep Interrupted, but it incorporates all the holistic topics. It goes beyond sleep and breathing into wellness, diet, nutrition, stress reduction, toxin removal. So it's a very comprehensive overview of health and wellness, but with the foundation of optimal breathing and sleep, because we don't
It
sleep.
sounds like you'll have a very different practice if you enter back into the world of clinical sleep medicine than you had before, right?
Absolutely, yeah.
That's awesome.
Well, Doc, thank you so much. Yeah, Robert was right. We're getting on for time. And so we sincerely appreciate you joining us today. Before we close, is there anything else that you would want to add a little bit about where people can find information about you and your book, your website, that sort of thing?
Well, my book is Sleep Interrupted. You can find it on Amazon. I do have a free resource for your audience. It's a free PDF called Energize Your Day Starter Guide. 5 simple steps to wake up refreshed and ready to go. And you can get it at energizeyourday.today.
.today. Okay. Awesome. All right. Well, thank you, Doc, so much. We sincerely appreciate you. And folks out there, we appreciate you as well. Thank you so much for joining us. And a huge thanks to our sponsors. And everybody, please don't forget to like, subscribe, and most importantly, share. Until next time, we say lights on.
Before we go, we would like to thank our sponsor, MedBridge Healthcare. MedBridge Healthcare is developing innovative inpatient, post-discharge, and population health programs to screen comorbid conditions, diagnose and treat sleep disorders. Learn more about their innovative solutions and career opportunities at medbridgehealthcare.com. Once again, you can learn more about their innovative solutions and career opportunities at medbridgehealthcare.com.
All right, guys. Post cows. That was an awesome show.
That was it was very good. You know, I think what's great about this conversation on Nocturia is it's something we kind of avoid talking about. You know, we kind of focus on the cause of things, not their effect very often. If we talk about effect, it's usually heart disease and some of the greater issues, but so many people struggle with Nocturia and challenges and that part of their bodies. So great conversation. I think it really elevated it to another level. And then really kind of understanding the mechanism physiologically that happens. It was great to hear that and loved hearing his explanation of the whole process.
Agreed.
Hey, I'm
Agreed.
personally just completely upset and flabbergasted that he told me I got to quit eating ice cream before I go to bed.
Hey, if
Yeah,
that's the
that
case,
was not nice.
yeah, if that's the case, let's quit right now and go grab some ice cream before it's time to go to
I
bed.
know, I know. No, it's great stuff. And you know what? For someone to have the ability to take some time off and to just pursue a passion. And by the way, we heard some potential news here that he may go back into clinical practice, which I think is exciting for the area of the country that he lives in. So I think it was great to hear from him. What I love the topic of Nocturia because it's not something like Emerson said. It's not something that we talk about very much, and
Right.
we know that it certainly is a problem that people deal with. And it would be interesting to see if we sort of went in sort of backwards and asked questions about Nocturia that led you to a potential diagnosis of sleep apnea.
I like that. It's the chicken and the egg, and I think oftentimes we can get focused on the wrong thing. And you're right. You know, what are some signs and symptoms that could lead us to the answer of sleep disordered breathing from the most unusual places?
Absolutely agree, Jerry.
I have nothing. I thought it was a great show, and
It was a good show.
I'm still thinking about that. But hey, let's call it. With that,
Yep.
let's go. And folks, until next time, we thank you so much for joining us. Take care. Have a great day, afternoon, or night, whatever time you're listening to. Thank you to our sponsors. And until next time, cheers.